What are employees and physicians doing to protect their families during this time?
Well, the first thing they do is we protect them here at work. So when they leave their families and come to work here, we make certain that that they all have the personal protective equipment that they need when they're taking care of patients. And again, that really varies from where you are. If you're in the ICU or you're in the operating room or the cath lab or in the emergency department, are you taking care of a patient that's tested positive for COVID or suspected? Are you doing a procedure that if could cause the virus to become aerosolized? So when you're intubating a patient or doing a breathing, you're going to wear a lot different PPE than if you're going into a patient room that they've tested negative or that's not why they're there. So it all begins first with the PPE. As Deborah and I were demonstrating, we're trying to practice social distancing, so keeping our employees away from one another as much as possible, but that's very difficult to do in a hospital setting. One of the things that we did last Friday is, well, the CDC didn't come out and mandate it or even strongly recommend it. We, on Friday, issued protective masks to every single one of our employees. And when I'm not on camera here, I'm wearing one myself. All 5,000 of our employees were issued masks. Most of us, somebody like me that's in an administrative role and not a direct patient care role, I was issued just kind of a standard surgical mask, which is different than an N95 respiratory mask that would be worn by somebody that is taking care of a COVID patient or suspected COVID patient. So that provides added protection for all of our employees. And it really was triggered by, I guess, the revelation that scientists believe that as much as 25% of the infected population may be entirely asymptomatic, meaning that they could have the virus and exhibit no symptoms whatsoever, no fever, no cough, no respiratory distress, but they're contagious. And so it really, to address that, to make certain that I could be one of those people who's asymptomatic and feels just fine, but if I was to cough or sneeze on somebody or spit, speaking to them, and I was contagious, I could get them sick. So I really wear a mask now to protect other people. So that's one additional thing we're doing to protect our employees. Other things, I know certain employees that when they go home, they go into their garages and they doff their clothes and leave them in the garage or wash them, collecting them to the side and putting on a fresh set of clothes when they come into the house. Again, just out of an abundance of caution. And then I think I might have spoke a couple weeks ago about a story I had read, two doctors on the front lines in New York, both with families. They weren't married to one another, but married with children and everything. And they were worried about, they were there on the front lines, truly incredible healthcare heroes. But they were worried about going home and potentially giving the virus to their families. So they decided to rent an apartment during the duration of the virus. And the two of them moved into this apartment that was right across the street from the hospital, and they were just going to gut it out and live there until the pandemic was over, and then they'd go return to their families. So kind of taking a cue from that, and we do have healthcare workers that are similarly concerned, just like those two physicians in New York. So employees, say the 7 employees that have tested positive, may not be comfortable going home and quarantining with their family. And so we have been working with local hotels, the Marriott, Quality Suites, a number of them. In fact, I have a little flyer here that just went out recently listing the phone numbers of the Marriott, the Holiday Inn Express, Comfort Inn Suites in Visalia, Comfort Suites in Tulare, Quality Inn in Tulare. Those are hotels that Cahuilla Delta has helped negotiate special rates for healthcare workers that, that want to be here near the hospital, still stay on the front lines, but to create that social distancing from their families to protect them more. Also, Airbnb is making homes and other dwellings available to healthcare employees at lower rates. And then we also, our Cahuilla Delta Sleep Center right now, where we normally do sleep apnea tests, it's closed right now, so we have 6 beds that we've made available to any of our employees or physicians that want to stay here and not go home. The Rotary Respite House, the Rotary is generously and without even hesitation has offered that to our employees and physicians to stay there. There are 2 housing units there. And then a number of community members offering up their RVs, their trailers, their motorhomes, campers, things of that nature. We have a beautiful motorhome that was given to us on loan from Country RV out of Fresno that's in the parking lot right next to our specimen collection site on Floral. But we have other motorhomes and similar dwellings that are being offered to us. So again, just the incredible generosity of the community just is overwhelming. I mean, it's actually, again, and I say it often, it's what keeps us going. I know our healthcare workers feel incredibly appreciated right now by the community, and just folks that are stepping up and just offering these kind of resources to our employees and physicians is just remarkable.